This video demonstrated the surgical technique for arthroscopic humeral avulsion of glenohumeral ligament repair utilized accessory posterior portal in the beach chair position. A 35-year-old male presented with chronic recurrent shoulder instability. His MRI shows complete humeral avulsion of glenohumeral ligament. We placed the patient in beach chair sitting position and opened the standard posterior viewing portal. First we identified the HAGL. The lesion was seen at the inferior axillary pouch. We created accessory postero-inferior portal using spinal needle just inferior to standard portal 3 cm. Then we dilating portal and established cannula for working in this area. Then we debride fraying tissue or loose body using arthroscopic shaver and electrocautery inside accessory portal. At first step, we pass suture at anterior part of HAGL using suture passer device, then we retrieve back to inferior portal. The cannula is essential instrument for suture management in this area. The next step, we use retrograde suture passer penetrating through middle part of HAGL. We plan to use these two suture for shuttling relay after the anchor insertion. We retrieved suture through accessory posterior portal cannula. We placed drilled guide sleeve through accessory working portal, slightly cephalad tilt. The location of the anchor placement was at the posterior cortex of humeral neck inferior to articular cartilage. Then we drilled the pilot hole and prepared for anchor insertion. We retrieved suture through accessory posterior portal cannula. We separated each sutures and planning for shuttering relay. First, we replaced blue hi-fi suture with tiger from anchor for the previous anterior stitch. And then we retrieve the next pair of suture, the PDS and blue hi-fi suture. We shuttling the second suture for going through previous middle HAGL stitch. We retrieved suture through accessory posterior portal cannula. Next, we use straight penetrating suture passer for retrieve the other limb of tiger suture passed through posterior part of HAGL tissue. All suture limb was prepared for modified Mason-Allen technique for knot tying. The tiger pair sutures using for pulling anterior to posterior tissue together. We using non-sliding knotted assisted with knot pusher for the knot tying. Make sure to secure the knot and reroute the suture limbs before tying. After we made the first knotted, the second knot tying was done same as the previous technique. The modified Mason-Allen can created the suture bridge that compress soft tissue to the footprint. After checking the knot stability, the suture's limb was then cut. Finally, we examined inferior axillary pouch. The HAGL tissue was reattached to the humeral neck footprint. Associated labral pathology and biceps were assessed by perform other procedures consequently. After the operation, the shoulder stability was excellent. Thank you for watching.